Hello, I'm Sanjay Gupta from St. Luke's Mid-America Heart Institute, and I would like to tell you about our EP Fellowship program here. So a little bit about us. We are a primary training site for the UMKC EP Fellowship. We're currently ranked number 25 out of all hospitals nationally for cardiology and heart surgery by U.S. News & World Report. We're the largest cardiology group practice in the city with 65 electrophysiologists, of which 6 electrophysiologists, 45 nurse practitioners, of which 5 are electrophysiology. We have 4 hospital locations with 12 satellite clinic locations. We're a large volume with over 700 ablations and 1,300 cardiac devices implanted annually. We have a large outcomes group that produces 180 publications annually. We're a national cardiovascular data registry coordinating center along with Harvard, Yale, and Duke. So the way our program is organized, we have a predominantly clinical program with a 2-year program. We typically take 1 fellow per year for a total of 2 EP fellows, a junior and a senior fellow. The program is designed around 11 clinical months with 16 weekdays of vacation and 5 weekdays for conferences, although we'll explain that you may end up taking more than that there too. Your first year is pretty much 100% of the time at St. Luke's, and then your second year, about 80% of the time at St. Luke's, and 20% of the time at Truman Medical Center. This year, we're looking for 1 clinical spot, and we are participating in the match. So our typical schedule for year 1 is that we would have, most of the time you're in the EP lab. We have a half day of clinic each week. Typically a half day every 2 weeks we recommend taking for research time. And research can be for actual research. We have lots of clinical research, which we'll talk about. But it can also be time to just read up on your patients and do some, kind of a little bit of downtime to do some independent study and learning and reading the literature as well too. And those can be scheduled on your own. We have 3 sets of organized lectures each week. We have a didactic conference that can be Monday, Tuesday, or Wednesday. We've just shown this here. And that's organized by each individual faculty. We also have cardiology grand rounds every Thursday, which frequently have electrophysiology topics. And then we have a Friday group electrophysiology conference, which everyone participates in, that rotates between journal club, research presentations, didactics, and case studies, as well as a quarterly morbidity and mortality conference. We have a very light weekday call system that is from 5 to 10 p.m., which I'll go over in a second here. So the way we're organized, we typically have consults that are staffed by EP attendings, typically before or between cases. These are opportunities to learn about systems-based practice. Our clinic is performed at St. Luke's Hospital at the Plaza, and you go to clinic with your EP attendings. There's also a device clinic that you can go to and get a high volume of device interrogations and get a lot of experience with doing that with our EP nurses. The conference schedule, the pure didactic conferences we have a curriculum that will mirror the ABIM blueprint of EP topics. So spans 2 years. So if you go through all the lectures, you should cover at least all of the topics at least once during your fellowship. The Friday I mentioned has a variable format each week, and everybody participates in that. The call is very, very reasonable. It's a home call. It's from 5 to 10 p.m. only Monday through Friday. There is no overnight or weekend call at all in this program. And really the call is only designed for management of post-procedure complications. The primary point of contact is a general cardiology fellow that's in-house, and then the EP fellow really exists as a backup for those. They average just literally a couple calls per week, so it's pretty light. The expectation is that if there's an issue, that you would also involve the EP attending who is involved with this procedure. Typically, we let the fellows organize the call schedule themselves. They usually take call about a week at a time because it's not very busy. In the second year, things change a little bit. The basic structure is the same, very EP lab heavy, but we have on 1 day a week, they go to our other location, Truman Medical Center, um, and they have a clinic on their own as well as an EP lab in the afternoon, also having call the second year as well too. Now, Truman Medical Center is located about 10 minutes from the Mid-American Heart Institute. It's the primary teaching hospital for UMKC School of Medicine. It was actually the first hospital in Kansas City, 243-bed hospital. It's a safety net hospital. About 75% are self-pay or on public Medicaid insurance. It's really been a significant, important component to our fellowship training. That the clinic in the morning, the fellows will go over there and actually be there by themselves seeing patients. Now, there's a backup attending, but they really get a great chance to transition into that attending role after graduation by really having to see the patient by themselves and come formulate a plan, and the patient really identifies them as their physician. And then at noon, the EP attending comes over to do cases, and they review all the clinic patients seen and provide educational content for that as well too. But when we survey our graduates, a lot of them say that was the experience that helped them get ready to be an attending, and they really liked that. In the afternoon, they do device cases at Truman. It's a good chance to practice system-based practice, doing inpatient consults. It's a different population than St. Luke's Hospital, Mid-American Heart Institute, which is more of a suburban. This was a more urban patient population, which has its unique challenges, but also has some interesting pathology as well too. They spend about 20% of their time there during their second year, which people have really enjoyed. So the strengths of our program are fourfold. So one, we really expose our trainees to a high volume and broad variety of EP procedures. We have a culture of outcomes-based research and teaching that promotes an academic environment. We are, being a tertiary referral center, exposes our trainees to complex patient presentations and management decisions to prepare graduates for really to go into any position anywhere. And then we have, between our numerous advanced practice providers and other staff, really maintain an appropriate balance of service and education. We really want you here to learn and to master these procedures and care of heart rhythm disorders. So in terms of our physical setup, we have 3 labs at our 4 labs really at our main location. 3 dedicated EP labs, which are all biplane equipped. 2 of them have cardo systems built in. 1 has ESI system built in. We also have a hybrid OR where we perform our structural heart procedures like Watchman, as well as device extractions as well too. We have a secondary location in St. Luke's East, where we have an EP lab with a built-in ESI system. There's also Truman Medical Center, where there's a shared space with cath and EP lab. In terms of our mapping systems, we have 2 cardo, 2 ESI, and a arrhythmia system as well on a cart that can be moved in any lab. We have 2 cryoablation consoles, intracardiac echo, fluoroscopy with Siemens that are all biplane, as well as laser lead extraction with Spectranetics. The labs are all really brand new, and some of them are very newly renovated and really state-of-the-art. So as you can see, our procedure volume has been steadily increasing year after year, both in our total ablation volume, left atrial ablation volume, and total device volume, as well as our left atrial appendage occlusion volume. We've now put in close to 300 left atrial appendage occlusion devices just in the last few years alone since FDA approval. We also do Lariat procedures, and we'll be doing the amulet procedure as well too now that that's FDA approved. Obviously, last year was everyone's volumes are down a little bit, but we have now recovered our pace and are back on track, even despite ongoing COVID pandemic. So volume is not a problem in this fellowship. We definitely have high volume, and this is show on the left is all of the COCAT requirements for certification for an EP fellow, and you can see this is one of our recently graduated fellows, and they oftentimes will have 2 to 3 times the amount of volume that they need to graduate. So you will not suffer for a lack of volume. In terms of the types of procedures that we do, we do essentially everything, all types of device procedures. Some of the novel things we do, we put in a fair number of leadless pacemakers and HIS bundle pacing, as well as subcutaneous defibrillators. We're a training site for that as well too. We do obviously all the diagnostic EP procedures. We do all variety of ablation procedures, including some of the atypical flutters, VT, both endocardial and epicardial. We also are engaged in clinical trials of pulsed field ablation, which I'll talk about a little later, which is a novel form of ablation. We also do some things that are pretty unique. We do the left atrial appendage, as I mentioned, the Watchman, Lariat, and now soon to be Amulet. Now that's approved, and we also do some things that are very unique, including we're a training site for putting in phrenic nerve stimulators, and we're one of the national leaders in this area. And this is a novel treatment for central sleep apnea that you can also get exposure to during your training here. We have a culture of outcomes-based research and teaching that really promotes a very academic environment. So one of this way this comes out is that we get a lot of new clinical trials. And so one of the things we're most excited about this year, we're one of the few centers in the country that is participating in not one but two clinical trials of a novel form of ablation. This is the Farapulse catheter shown here. This is the Medtronic catheter shown here. And this is a novel form of ablation that is non-thermal, meaning it's not heating or cooling, but delivers pulses of electrical energy that very efficiently and accurately eliminates potentials for inside the pulmonary veins, yet doesn't seem to have any effect outside of the cardiac tissue, which really has an excellent safety or an efficacy profile. So we think this is going to be a game changer, and we're pleased to be able to offer this experience to our fellows during their training. So when this becomes available for everyone, they will have already had experience in using this. We also have really strived to get zero low fluoroscopy procedures, and we've accomplished this by a tremendous use of our intracardiac echo and 3D mapping, and we do many procedures with no fluoroscopy, many with very, very low. This is a cryoablation being performed with a ICE catheter, demonstrating the balloon in the left superior pulmonary vein. And so we can do a lot of this guidance off of ICE, and so you will get very, very good at ICE during your training here. And we think that's really going to be important skill to have when you get into practice, and you will really be ahead of other physicians if you have mastered the skill during your training. We also have some really novel things that are only available a few places, and we're happy to offer them here. This is a cardio insight system, which creates a non-invasive 3D electroanatomical map. So patients put on this vest, which has 252 electrodes, which can record unipolar signals from the entire body surface. And the patients then go through a CAT scan wearing this vest, and they can create this 3D anatomical map shown up on the right. And this allows a comprehensive activation map of the entire cardiac rhythm that's as fast, it can record as fast as a single beat. This is the gray diagonal is the LAD. This is the left ventricle, right ventricle. This is a ventricular tachycardia that originates from the left ventricular alpha tract. You can see that as this activation starts, follow the white trail, it comes out of the LVOT and maps down the anterior LV and goes there too. We're engaged. We're doing a clinical trial on use of this to guide ventricular tachycardia ablation. And again, another experience of a tool that you will get to use here that was not available in most places. So there's several additional learning opportunities. We provide several textbooks for our fellows free of charge. We provide access to a lot of online learning modules from ACC, EPSAP, ECG skills. We also provide access to board review materials for both Heart Rhythm and Mayo Clinic board reviews. We do in both the annual in-training Heart Rhythm Society in-training exam, as well as we have our own internal in-training exam that we give for practice as well too. Really do encourage our fellows to attend outside conferences. It's been challenging the last year with COVID, but many have been able to go, and we've been always encourage them to attend these as they're important complementary education. But even if you don't want to leave Kansas City, we have several programs right here in Kansas City that we run and sponsor, and fellows from other programs will come to participate. One is an evening program with all the electrophysiologists in the Kansas City area, where it's an evening discussion called the EP Masters, where electrophysiologists take turn presenting cases to each other, and it's a great environment for fellows to really see and be part of. and see different electrophysiologists as we kind of argue and debate different challenging cases. We have two formal courses that are regional. One is called Current Cardiology Concepts, where we do a sheep heart dissection in the beginning with clinical correlation, lectures, and then procedural simulations as well. And that's typically offered in the fall in September, as well as another conference that we host called the Kansas City Cardiovascular Summit, which is more pure electrophysiology focused and then has just the latest and greatest of current topics in electrophysiology that our fellows can attend and participate in as well too. We're also a training site and have host training courses for cryoablation, watchman placement, as well as front air pacing that our fellows are obviously welcome to participate as well, but you will get this every day as well too. So being a tertiary referral center, we do get chances to expose our trainees to complex patient presentations and management decisions as well to prepare them to enter practice. So one area that's an example of this is we have a lot of patients with adult congenital heart disease. We've done several of these cases shown here, atypical flutters and Fontan patients, VT ablations, and tetralogy flow patients. We host a citywide adult congenital heart disease conference every month, and so all the adult congenital heart patient physicians from around the area will meet and will discuss and get cases. We also have started an elective at Children's Mercy Hospital where you can spend 2 weeks each year. You can do up to 4 weeks if you want at Children's Mercy Hospital, shadowing over there and seeing cases in pediatric patients, which is a great experience to learn a lot more about pediatric EP and how to, again, take care of those adult congenital heart patients. So we also are a large transplant center. We've actually, this needs to be updated. We've now performed over 900 transplants, and we have averaged about 35 to 40 a year. There are issues that are arrhythmia issues that are unique to transplant patients, like sinus node dysfunction, which about a third have that require a pacemaker. Also, transplant vasculopathy and resulting cardiomyopathy, resulting in defibrillator implantation. Then, as well as frequent arrhythmias around the atriotomy scars, commonly atypical left atrial flutters or right atrial flutters that need to be ablated, and then we have taken care of many of those post-transplant arrhythmias as well too. This shows a right atrial map with a atriotomy scar with an atypical flutter. So we do also have our fellows participate in a quality improvement project during their time. They will pick a topic and a faculty mentor, and they'll follow the plan, do, study, act workflow. This is an opportunity to publish if you're interested. Some of the things we've done, including protocols for MRI and non-conditional device management, preoperative protocol, and protocols for putting in a pacemaker after a TAVR. We also encourage and provide numerous opportunities for our fellows to do research depending on their level of interest. You can work with all of our faculty on research, which everyone participates in research. You can participate also in outcomes-based or registry research based upon our other clinical faculty. And looking at large databases and looking at outcomes, there's lots of resources for that. We like to have our fellows at least present one project at a national meeting during training, and so far we've been successful at getting all of our fellows to do that. We also encourage them to at least publish at least one original article in a journal before training. It can be as simple as a case report, as complex as a clinical trial. But these are we support that and encourage that. This is one of our fellows presenting recently at Heart Rhythm Society. So we are working on integrating a dedicated cardiac simulation center housed on our campus where we will be able to provide procedure simulation in preparation for device procedures, as well as computer-based simulation for procedures and patient care scenarios, and group simulation for emergent conditions. Until we get the dedicated center, we have there is at the University of Missouri, Kansas City, just down the street near Truman. There is a dedicated sim lab there that our fellows can have access to, and we have access to all of this. Many of our simulators are housed there, and we can bring them over to the Mid-American Heart Institute for any of these things too. So we have several simulators that we will you'll get a chance to participate on, which is great for building kind of muscle memory, working out everything from access to suturing to pericardiocentesis, to doing ablations. We also will bring in various simulators from industry, including simulators of ICE, extraction, things like that will get our fellows to practice. So simulation is a very important part of learning new procedures as well too. So some of our recent graduates, they've been very successful. We have had several that have gone into academic electrophysiology, like Dr. Ramirez here is at the University of Kansas, and Dr. Spooner here, as well as people that went into private practice, including Dr. Taylor, Dr. Dute, and we give you their info, and all of these have volunteered to speak about their experiences as a fellow at our institution, and we encourage you to reach out to them and hear it from them. In terms of our faculty, I'm the program director. I trained at Michigan. My associate program director is Dan Steinhaus, who trained at Harvard. Dr. Wimmer is our head of electrophysiology, and he also trained at Michigan. Dr. Ramza is our research chair, who trained at Hopkins. Dr. Giacondo trained at Baylor, and then Dr. Yusuf trained at Hopkins as well. So we have numerous advanced practice providers and other staff to really help balance service. So we're not really asking the fellows to do all the work, but really an appropriate balance between service and education. So these are our 5 really amazing, very intelligent and hardworking nurse practitioners. There are always 2 of them at our Plaza location, which is the main location, and they really help take care of patients before, do a lot of the prep, for pre-procedure as well as post-discharge planning, orders, and do consults as well too. So they really help out a lot and are a great resource and another educational opportunity for the fellows as well, working with them. We like to think our program is really very relatable and fellow-centered. We really try to, we're very supportive. We really want our fellows to be happy during their time here. Fellowship can be a difficult time. We really want you to reach out with us with any concerns at all. You can call, text us, email us anytime. We've got layers of mentorship and support. Jeanette is our program coordinator and does all things for the program, but also is another resource and help for our fellows, and she is a wealth of practical information as well too. And we want this to be a fellow-driven program. So there are things that you want and things that you want to see us add to the program. Let us know, and we'll work to make it happen. We actually really have a good environment. Everyone really enjoys each other, and it's a lot of fun. The staff in the lab, we joke around a lot, and it's a great environment to train in. So that's our summary. We look forward to welcoming you virtually at least this year, hopefully next year in person. But these are my emails and Dr. Steinhaus's emails, and please reach out to us. These are some great views of Kansas City, but we hope you'll consider training for EP at our institution.